Welcome to Inside Aesthetics, the world's leading podcast for injectors and aesthetic businesses. I'm Dr. Jake Sloan, an aesthetic doctor with over 16 years experience in facial aesthetics.
And I'm David Siegel, an entrepreneur and business mentor with over 20 years of experience in our industry. Our podcasts are aimed at industry professionals, and any information or advice given is general in nature. You should consult with a healthcare provider before undergoing any treatment.
You can also subscribe to us on Patreon for on-demand content for injectable and business education.
All right, Jake, welcome to episode 278, which is chapter 7 of What's Trending in Aesthetics. And we're joined by the chief troll himself, Dr. Stephen Land, all the way from the UK. Thank you for taking time out of terrorizing our WhatsApp groups and joining us for a podcast. You're a barrel of fun. There's never a dull moment in our chat groups when you're around.
Yeah, we should explain for the listeners. So Stephen is a good friend and cosmetic physician in the UK from Newcastle, and he's one of our Patreon members. And in our WhatsApp groups, he is not shy to share some British sarcasm and, create some fun.
It's always interesting watching people's reaction to cultural differences between humour and, you know, when there's no sort of tonality and body language, just seeing how people interpret these things.
Yeah, it can go the wrong way. Anyway, how are you, buddy? I know it's early in Newcastle. Thanks for joining us.
Yeah, good. Thanks for the introduction. Yeah, I remember. I'm always reminded of the first kind of time you set up that WhatsApp group in the very early days, when we injected some British humour in it, and then had to sit and explain to everyone how British humour worked, and the fact that we take the mick out of each other means we actually kind of quite like each other.
Yeah, it doesn't always work. I've realised that people in Brazil and America and other places, sarcasm is not their way of having fun.
As Jack Nicholson said, sarcasm is anger's ugly cousin.
All right.
There you go.
Well, there we go. It doesn't work well on David, to be honest, like, especially in our own private WhatsApps. He often gets the hump with me. So anyway, let's get into this podcast.
What are we talking about?
Well, these What's Trending in Aesthetics podcasts, if you've missed our previous 6, we try and tackle news, stories, controversies, and anything that's sort of doing the rounds on social media. And today's a very important and big one. So about a month ago, there was this big story about a death of a patient in the UK. A very sad story. The patient was called Alice Webb. She was 33, a mum of 5, apparently. Yes. And, Stephen can sort of fill in the blanks, but, it caused obviously uproar, both just, in the general public, but also for injectors.
Yeah.
Did you hear about it?
I did, yeah. I mean, whenever these things happen, they get a lot of traction and stories are reshared on social media. So I did hear about this. I mean, to be honest, we're very lucky. We're in an industry where we don't hear about these things too often. So when something catastrophic like a death or someone having a severe VO complication, people tend to hear about it pretty quickly.
Yeah. Yeah, it's always scary, and as experienced injectors, we always kind of recheck what we're doing. Are we doing the right thing? And we look at all of our protocols, etc. But Stephen, tell us, I guess, the high level what was discussed. I guess in the UK first of all.
Should we do a disclaimer before we go into that?
Yeah, good point. Yes. All right. Well,
before Stephen goes to jail, let's do a disclaimer.
Good point. I guess what we're going to be discussing is, speculation to some extent, because we don't obviously have the full details, but we can only tell what's already been shared in the UK media and newspapers and on the internet. And there are some comments from people involved in the story. I've sort of read those. So, we're not trying to worsen what's already happened, but, it's a serious thing that we want to bring light to, I guess. So, Stephen, take it away.
So this was an incident that occurred about 4 weeks ago now, when we started kind of seeing news reports that, it started off as kind of the usual social media rumours, as these things tend to do, but then actually developed into genuine news reports that someone had unfortunately died after undergoing aesthetic medicine procedure. It turned out that procedure had been a kind of filler liquid butt lift, performed by a non-medical injector. And the non-medical injector in question is a guy that's been in the news a number of times before for various things. He's a guy that's been on Botched a couple of times. He's been featured in the press for potentially the sale of kind of illegal versions of the kind of weight loss injections. So he's a guy that's kind of fairly well known in the industry in the UK. And yeah, unfortunately, this lady's kind of had her kind of liquid butt lift done on one evening, admitted to hospital fairly soon after, and unfortunately died the next day.
That's terrifying. The presumption is she had an embolus from filler going into the gluteal veins. I mean, we don't know that, and I don't know if there is a sort of a coroner's report, but that's a well-known complication from this type of procedure.
Yeah, I mean, the thoughts doing the rounds are, there's a couple of potential things it could be. Some, the question of sepsis was brought up, but obviously it's a very kind of short time frame. So yeah, you're looking at something that's kind of fairly quick to take its effect. So there isn't an autopsy report yet, so nobody really knows. But the speculation is obviously that it's something kind of fairly quick to happen. So either a large embolus into a vein that's kind of gone around and got trapped in the respiratory kind of circulation, or potentially something like local anesthetic toxicity, given the volumes of filler that were being told were injected.
Did they say anything about the technique or the volumes? Because, I mean, David asked off air just before we started, because when we talk about non-surgical butt lifts here in Australia, it's relative, I won't say common, but the most common way of doing it would be using something like a biostimulator in the skin. So not, down in the muscle or fat layer to, sort of tone and maybe help with cellulite. That's a reasonably recognized procedure, at least here in Australia. But I think what we're talking about is seemingly a much larger volume of product. And I heard it was hyaluronic acid. Injected probably deeper. Is that your understanding, Stephen?
Yeah, so that's my understanding of what's happened. There are a large number of people in the UK doing kind of filler bum lifts using kind of HA filler of various varieties, and injecting some really quite large volumes. Even locally to me, there's people injecting kind of 400, 600, 800 mils of filler, which is obviously a ridiculously large amount to be injected in one sitting. The rumours on social media that we're seeing is that this was over a litre of filler injected kind of across both buttocks.
How much would that cost?
Well, what filler is being used?
I mean, that's the other thing.
A litre.
Because there's so little regulation in the UK, there are fillers of various qualities available, shall we say. You've got your kind of top of the range stuff that you would recognise in Australia and the rest of the world. You kind of Juvederms, your Teoxanes, your brands that everyone's kind of heard of, all the way down to fillers that I keep my finger. Like to think I keep my finger on the pulse, but there are some that kind of surprise me that come in 50 ml syringes for about £60. So once you're getting into that territory, it becomes affordable to stick ridiculous volumes into buttocks.
That's absolutely ridiculous.
Yeah.
I have to say, I was doing a bit of research about, I went down a rabbit hole because I'm on a couple of Facebook groups and forums, I'm sure you are, Stephen, where and there are some non-medical people in these groups. I just sort of want to keep my finger on the pulse of what's going on around the world. I don't really interact in these groups, and the types of things that are discussed, but also, like you said, Stephen, the things that people are willing to buy or how even they buy them. They're quite happy to buy through a WhatsApp group or a Facebook group or all sorts of kind of unusual routes. And you kind of think, well, I don't want to point fingers at people who are non-medically trained without any evidence that they shouldn't be doing it, but it does seem that they don't know what they don't know. You know what I mean? It's sort of like, it's not normal practice to buy a product that you're going to injecting someone through a Facebook group. It just seems unusual.
Yeah. I was having exactly the same discussion actually randomly with a reporter from ITN News yesterday or the day before about where people get hold of kind of these illegal products or kind of slightly dubious products. And she was genuinely amazed to hear that I could send her quite happily within seconds some WhatsApp messages that I get sent saying, do you want to buy this toxin or that toxin? And as you say, I think it is a case of people don't know what they don't know. And these kind of pharmacies that set themselves up on kind of WhatsApp will quite happily lie. I get messages, I say, all the time from these pharmacies asking if I want to buy this, that, and the other product. And I thought one time I'll just act sweet and innocent and see what happens. So I said, you've offered me all these toxins. Like, do I not need a prescription to buy these? And they said, oh, no. If you say they're for personal use, you can buy whatever you like. And I was like, okay, fine. I was like, some of these toxins I've not particularly heard of. Do they have a license in the UK? And they're like, oh no, they don't have a license in the UK, but what they do have is FDA approval. And if they've got FDA approval, that means they're okay to use worldwide. And, obviously, because I have some knowledge, I was sitting there thinking that's complete BS. That's just a complete lie. But if you didn't know any better and you've got a pharmacy telling you that this is the way it is, you might believe them and buy things off them.
Yeah, I have to say, I've even heard some Australian, I guess, injectors quoting things like, it's FDA approved. And I'm like, and we're in Australia. What does it matter?
Yeah.
And I don't believe those ones that are claimed to be FDA approved are actually FDA approved. If they're selling it from Europe, then it probably isn't FDA approved.
Well, yeah, I mean, as I say, I keep my finger on the pulse, and these are like toxins that I know have approval in South Korea. Some of them have approval in China, but they definitely do not have approval in America or Europe or Australia.
But you're also assuming that the version of these products that you're getting are legitimate. So because yes, we're talking about technically something's not approved by the TGA or the EU. FDA is America's version of our regulatory TGA. So you would assume that even though it's technically not approved, the fact that it's approved by another developed country with similar health standards to us, that technically might not be approved, but probably not going to be the worst thing in the world. It's still approved in another country that has regulation. But you're assuming that these products are actually the legitimate version of those products as well.
Correct. Yeah, it's pretty scary.
That's the thing. I'd say some of them have approval in South Korea, which is, a big aesthetic market. So you kind of think, as you say, if they've got approval in South Korea, they're probably reasonable products. They probably just haven't quite got around to sorting out approval in other countries yet. But yeah, that's the other issue is, it's coming from a WhatsApp group. These are biological products that are supposed to be kept refrigerated until they get to your front door. How can they prove that? How do you know that's true? How do you know, as you say, that these products are genuine? And yet people are kind of quite happy to buy them and inject them into each other.
I mean, I guess we're sort of implying that maybe the product is the problem, and I don't think that is the issue here. I think the issue really is, maybe someone not fully trained, someone who maybe doesn't have experience, the support, resuscitation equipment, know-how. All of that is really the issue here. I mean, we can talk about product, I guess, after. But what was this injector's background, Stephen?
Yeah, let's unpack that. Who is Jordan James Parke?
Yeah, I mean, his name's out there in the public, so I guess we can name them. And I actually gathered that someone else was also arrested from his clinic. It wasn't just him. I don't know their name. So, fill in the blank, Stephen.
Yeah, so as you say, products are part of the issue, but the main issue is kind of untrained people injecting whatever they want into whoever they want. So I say this guy is kind of fairly well known in the UK. He's got like 100,000 followers on Instagram. He is a guy that's been on Botched a couple of times, kind of wanting more treatments. And the plastic surgeons on Botched basically kind of said, look, what you need is not more treatment. What you need is to maybe speak to someone about the kind of potential body issues that you have. And he decided what he would actually do is go in and get himself trained in aesthetic procedures, and has then set up in and around his kind of hometown of Manchester doing, all the usual kind of aesthetic procedures, tox, fillers, and all that sort of stuff. And has then kind of slowly graduated onto doing kind of bigger and more exciting procedures like breast filler and bum filler, and has then gone on to kind of start teaching other people. And like a fair number of people, he does kind of here, there and everywhere. And one of the places he kind of worked out of was down in Gloucester. And the other person that was arrested is the person that kind of owns the clinic and runs the clinic in Gloucester that he was using.
Right.
So she was kind of the facilitator of him being there.
I mean, not to make some rash sort of accusations, but like you said, he was on Botched. I did actually watch that clip. I think it was 2016, and he self-professes, I'm addicted to lip filler. He, I think anyone who looks at him in the video can understand that he probably does have an element, or if not true body dysmorphia. he was obviously on TV because he's quite an extroverted person, and Botch doesn't invite, inverted commas, normal people. They want to showcase unusual cases.
Yeah. They're not going to have boring people on, are they?
No,
People that
we've had Paul Nassif on the podcast. He told us about the whole process and selection process, and that was episode 100 if you missed it. But is there even a bigger issue that injectors, whether they're non-medical or medical, if they have apparent body dysmorphia, again, that's quite a difficult dilemma for when they're offering services to the public. What do you think?
Well, and also they also become a beacon for other people who suffer with the same issue. So a lot of people who could go to someone like yourself, Stephen, or you, Jake, and you might say, look, I'm not comfortable undertaking any further treatment with you. Maybe you should go and see someone about, as you said, your body self-image and maybe some body dysmorphic issues. But when someone's out there who looks like they have those issues, they all now become a place where people who are also maybe overcooked and
you attract a certain tribe.
Correct.
For sure.
So it's what becomes like this self-perpetuating, because now they've got one of their people who's willing to do injectables. So these people who normally wouldn't have gotten treatment are now. I mean, we're just talking about the worst case scenario when someone dies. What about all the other issues that are going on with people that are continuing to perpetuate
just aesthetic and potentially safety issues, VOs, etc. I mean, I'm sort of mindful of, I don't want to tar this guy. I've never met him. I don't obviously know him personally, but you see him on a video on Botched. It's quite extreme.
Yeah.
Yeah.
And you know what I wonder as well is, do you think that like him or other people who are non-medics doing these treatments actually in their own mind think that what they're doing is perfectly okay? Or do you think that they actually realise that this probably should be done by a medic, but there's a loophole and they're going to take advantage of it? Do you think they have those insights? Or do you think they're doing the wrong thing, willfully doing the wrong thing and taking advantage of a gap in the system?
I think it's like everything. There's probably a spectrum. There are probably some people out there that kind of have those thoughts and think, actually, I'm just going to exploit this loophole while I can and get away with it. But there are definitely non-medically trained injectors out there who feel they have as much right to be injecting as anybody else. And we see this, as Jake said, there's a lot of kind of non-medic support forums out there. And like Jake, I do kind of hang around in the background of a few of them just to kind of keep my eye on what's going on. And there is definitely a feeling amongst a lot of them that they have as much right to be injecting as anyone else. But yeah, as you say, it kind of comes down to that thing that we talk about kind of quite a lot in medicine, the kind of Dunning-Kruger effect of you don't know what you don't know. And that's the issue. A lot of these injectors are unaware of all the potential things that can go wrong. And I think unless you're aware of what can potentially go wrong, it's very difficult to try and mitigate it.
Here's a can of worms that I'm going to propose to you or ask you. So here in Australia, it's very defined. We've got doctors, nurses, dentists. It's easy. There's 3 professions that can pick up a needle and inject someone. So there's no real argument about anything outside of that. Or have you ever heard of any non-medics injecting here? It must be super rare.
Well, yeah, that was the girl that died from the breast filler a few years ago. So it was someone who was masquerading as a doctor. So knowingly doing the wrong thing, and it was actually, I think it was tramadol. It was an overdose of that. It wasn't actually the product itself.
Yeah.
So kind of, that's the only one I've heard of. I'm sure they got one.
I mean, compared to the UK, it's very rare.
Yeah.
Whereas obviously in the UK, you've actually got a bit of a spectrum. You've got doctors, nurses, dentists, but then you've also got, I guess, a different tier of pharmacists, prescribers, and paramedics, and some other, if you like, recognized different professions who seemingly are not in the non-medical classification. And then you've got true non-medics. I don't know how to sort of classify them any other way.
Your roof tiler.
Well, yes. I mean, they could be hairdressers or anything. I guess not even allied health professionals. They're just, randoms off the street, basically. So the curveball is, where do you draw the line?
Yeah, this is something I've kind of thought about over the years, actually, and had a sneaky suspicion you might ask this question. I was like you, like when I first started doing this kind of 11 years ago, I was like, okay, doctors, dentists, nurses, that's kind of quite easy. I'll draw the line there. That's my criteria. And that was just based on the fact that I work with doctors, dentists, and nurses. I know what they do. I know what their background is. I know what their kind of qualifications and kind of background knowledge is. So that just made it very simple and straightforward, as you say, to go, I'm happy with these three groups to do it. And then, I disagree with anyone else doing it. That was a kind of fairly simple line in the sand for me to draw. And then after a few years and seeing, who else is out there injecting and what they were doing, and realizing that, people like Gillian Murray, who's a pharmacist, are doing fantastic work within the aesthetic sphere, particularly with regard to kind of complications, it kind of got me thinking, I probably actually need to apply some logic to this and actually think about it a little bit more and have a more robust sort of argument, as it were, rather than just kind of arbitrarily drawing a line in the sand. So I thought, right, what criteria do I think are a good idea? So my personal criteria, and I'm happy for me, I'm happy for people to argue with me about this, and I'm happy to be told I'm wrong. But my personal criteria are: you have to have a degree level qualification in something medically related, because that shows you've got the kind of background, kind of intelligence and knowledge to kind of deal with these sorts of issues. I thought you've got to have a regulatory body. I think that's probably one of the most important things. So you've got to have a kind of higher authority who is willing to take you to task should things go wrong, or should you be acting outside of your kind of remit. But then I also thought, actually, that regulatory body has got to accept that performing aesthetic medicine procedures is within your remit as a whatever professional you are.
Yeah.
And if you apply those criteria, you get, obviously, there's lots of medical and paramedical type degrees. So that's a kind of big group. If you look at all the people that have got a regulatory body, that narrows it down again. And if you look at the regulatory bodies that accept that aesthetic medicine is within the remit of their members, you've got the GMC, the GDC for dentists and dental therapists. You've got the NMC, and you've got the General Pharmaceutical Council for prescribing pharmacists. So that's now where I kind of draw my line. And that was just so I got a kind of robust argument and some thought had gone into it, and I could kind of go, right, these are my criteria. This is why I think you should be doing it and why you shouldn't be doing it, because you've got a regulatory body, and if you start acting like an idiot and doing stupid things, they will take you to task over it.
Yeah. You would have, well, you'd know this more than anyone, but in the UK, there's now a move to, I don't know what they call them, you'll know that there's a sort of a second tier of doctor now who are being sort of qualified to, I guess, help out in the NHS. What are they called, Stephen?
Physicians associates.
Okay, physicians associates. Now, of course, in the States, we have physician assistants who are extenders, and we've had several on the podcast, and they're doing good stuff. So again, where do we draw the line? Are these physician associates going to be doing Botox? And was that the point of training them to help doctors and then leave the NHS? It gets a bit difficult to sort of draw the line, doesn't it?
Yeah, I mean, at the moment, physicians associates have only, I don't think they're formally registered with the GMC yet. The GMC has said that they will take them on as their regulatory body, but at the moment they're unregulated. So at the moment they fall outside my criteria.
Right. Fair enough. What are your thoughts? How can we explain to someone who maybe is a non-medic listening why, well...
Okay, would you want someone that isn't a licensed builder building your house?
Well, they will argue, well, I've done the course, I'm level 7, which is the qualification in the UK.
Yeah, but what happens if the house falls down? So they don't have builder's insurance. I mean, yeah.
The thing I always liken it to is flying a plane.
Yes.
I quite fancy flying a jumbo jet. I think that'd be a good laugh. And I was in the Air Cadets when I was at school, so I've flown little tiny planes. So, would you let me have a go at flying your transatlantic flight next time you come home to visit your folks, Jake? Or would you want someone who's actually a pilot? You and
I can see that logic. It's very obvious.
I think it would be fun.
But these people will be saying, but hold on, I've got the jumbo jet license, level 7 injecting license, or whatever it's called in the UK. They've done that qualification. So how do you or we argue against that when they've got the certificate on their wall hanging saying you're approved?
I mean, I think the reality of the situation is, unless this becomes a major issue that has ongoing media implication and there is pressure applied to government officials and regulatory bodies, nothing will happen. And who knows at what point that will actually occur. the only way to stop this is to remove the demand or reduce the demand. If you cut off the money supply, then these people will cease to exist or exist at a much lesser capacity. So if I was someone in the UK that wanted to rally behind this issue, if it was a big enough problem that we could get people together, is actually go on a campaign to educate the public more so, because I can't imagine that all the people that go and see these practitioners, in inverted commas, fully understand the risks. They probably see this as a beauty treatment. What could go wrong? This person's got the product. So I think there's ignorance there. I think the only way to tackle this, because you can't rely on the government to do anything, is to actually put an effort into educating the public to reduce the demand.
Yeah, I mean, don't want to throw Alice Hart Davis under the bus here, but I feel like someone like her could be a figurehead to get the public to understand what the hell's going on, because she is like a professional patient. It's her job to communicate to the public.
Alice has just been taken on as a brand ambassador by the British College of Aesthetic Medicine within the last kind of few weeks.
Oh, right.
I suspect that will be kind of part of her remit. Obviously, we have various associations in the UK that kind of represent people doing aesthetic medicine. So there's the British College of Aesthetic Medicine. There's the recently renamed British Association of, what's it called? It's the Nurses Association. They've just rebranded, and I can't remember what they're doing.
There's too many acronyms in this world, Stephen.
We have got various associations that kind of promote safe practice and kind of represent doctors and nurses and what have you. And they have just taken on Alice Hart Davis as a brand ambassador, so I suspect that might be kind of part of her role. But sometimes the problem is that there's kind of 3 or 4 bodies representing the different groups. So there's BCAM for the doctors, there's BANAM for the nurses, and the dentists have recently been allowed to join BCAM because they didn't have one of their own.
Right.
And these associations sometimes don't all kind of pull together in the same direction, although they are getting much better at it. I think you're right. I think educating the public is very important. But at the same time, actually kind of trying to apply the thumb screws a little bit to our members of parliament is proving it can be useful. But as you say, that's a very, very slow process. I've recently been in touch with my MP kind of after we had an election in July, and I thought post-election would be a really good time to get in touch with them because, some of them will be brand shiny new with not really a lot on their plate. It might be a good time to kind of give them a little cause to be interested in. Mm. So I did try and encourage everyone in the UK to write to their MP. And I tried to encourage them all again after the recent deaths to say, look, this is an opportune moment to try and get some MPs interested in it. And to be fair, my MP was actually kind of very interested. Like I wrote to her and said, there's no regulation in the world of aesthetic medicine in the UK. And she kind of, I had a meeting with her, and she kind of said, when in your email, I kind of assumed this was kind of, hyperbole of and what you meant is there's very little regulation or not enough regulation. But I've been away and had a look, and when you said no regulation, what you meant was no regulation. I was like, yeah. So again, I don't want to kind of point fingers here, but this is kind of on you. You're in charge of running the country. So when I tell you there's no regulation, that's not my fault. That's down to you guys. And she was actually very supportive. We're organising some stuff. She's been in touch. We've written some things. So I think a lot of the time it's just that the powers that be are not aware of what the potential problems are. And coming back to David's point about kind of risks, and callous as it may sound, I think part of the problem is that these procedures are inherently pretty safe. Jake will know this. We kind of talk about the risks of vascular occlusion and problems like that when we're consenting our patients. But actually, the numbers of significant problems that we see are very small. I've been doing this 11 years. I've had one vascular occlusion. I've dealt with a fair number of others. But, the number of patients that you see, the number of big problems that you encounter is very small. So I think part of the problem, if you want to look at it that way, is that these procedures are inherently pretty safe. So we aren't seeing, deaths every week. The fact that this has hit the press and been such a big thing is because it's such a rare thing.
Yeah. And what do you think will happen to this person? I mean, there's no regulatory body to step in and discipline them. So I'm assuming it's going to be civil action by the family, or will he be prosecuted potentially for murder by the police?
Yeah, I mean, the 2 people that were arrested on charges of kind of potential manslaughter. So right. I don't know down what avenue the kind of police and the CPS will kind of wander to try and to try and prosecute these people. So I don't quite know under what regulations they'll go for, because, as you say, what they've done is not actually illegal. It is perfectly legal in the UK for anyone, qualified or otherwise, insured or otherwise, to pick up a syringe full of filler and stick it into your face, bum, boobs, wherever you want to stick it, really. So from an injecting point of view, they've not done anything that's wrong in this country.
Yeah. Well, how big do you think the problem is? How many of these practitioners are actually out there in the UK? Like, what sort of, can you quantify the problem at all?
Again, we don't really know. And that, again, comes down to kind of lack of regulation, because there are no regulations and no one needs a license and no one needs any qualifications. I can't really tell you how many there are out there, because, no one's keeping a record of it. No one's kind of keeping a license scheme of who's registered and who isn't. So we don't really know how big the problem is.
I mean, would you guess it's hundreds or thousands?
Oh, it's definitely thousands.
Right.
Definitely. There's, if you look at some of the bigger cities in the UK where there's a lot of non-medics being trained, so kind of Manchester and Liverpool have an awful lot of kind of non-medics being trained. There's probably thousands in and around Manchester and Liverpool alone. So, yeah.
That's terrifying.
There's lots and lots about that.
Can you explain to our listeners abroad, we're sort of assuming that everyone understands this UK kind of quirk in a way, but it's a serious issue. How and why has it come to this point, or why has it always been that way? Because it's not like this in most other countries. So why the UK? What led to that?
I don't really know is the honest answer to that. But as you say, it's a kind of UK specific issue. And I think when you speak to injectors from other countries, they either don't believe you or they think you're taking the mick. And then they slowly kind of have this dawning realization that we're telling the truth, and they just stand there looking open mouthed, kind of flabbergasted at you. But from what I can fathom, and from my research, the UK is the only country in the world that I can find that has no restrictions on who can inject. So there's literally not a single restriction on who can inject. And that's in terms of background qualifications or in terms of training and insurance. So again, this is the discussion I had with my MP the other week when and I always kind of say this to drive home the point. In the UK, you could literally sit and watch some YouTube videos this afternoon about how to do lip filler, and there's kind of plenty of them out there. You could go on one of the slightly dodgy websites this afternoon and order yourself some filler for next day delivery. And when that arrives tomorrow morning, you can set up doing fillers in your kitchen. And that's completely fine legally in the UK. You need no training, no qualifications, no insurance, no nothing. You can literally just pick up a syringe of filler and stick it into someone's face. Quite how we've allowed that situation to occur, I don't really know. I think in the UK, we have a habit of being slightly reactive instead of proactive. So we kind of sit there. We have a habit of kind of sitting here waiting for something to go wrong and then going, perhaps we should do something about that, rather than kind of looking at what, the representative bodies, what the kind of experts are saying about potential risks and going, maybe let's do something about that before it becomes a problem. So
it just seems so weird. I mean, I think we've used this example before, but let's say David lives in the UK, non-medic, and he decides, you know what, I'm going to have a crack at doing some fillings today. And, he was caught and it was in the papers that, David Siegel is doing home dentistry. I think anyone under the sun could understand how mental that is. And yet that logic doesn't seem to apply when it's people doing, lipo in their kitchen, which is another thing that we're going to talk about, because I've seen some stories about that. I mean, why is that? I don't understand. It just seems so mental. Yeah. It's clearly dangerous.
I know it's a preposterous situation that we've allowed ourselves to get in. I am not sure how it's kind of come to this. It's just this weird way it's developed in this country. There's a narrative goes around amongst the kind of non-medics. Their narrative about why they all inject is that toxin and fillers have always been a beauty treatment, and it's an extension of a beauty treatment, and it's completely ignoring the kind of 100 and odd years history of aesthetic medicine, which started as a branch of plastic surgery. It's the kind of non-surgical version of plastic surgery, like plastic medicine, if you want to kind of give it a name. And they completely ignore that and just kind of go, no, it's always been a beauty treatment. It's just an extension of what we've always done as beauty therapists. And I don't quite know where that narrative started from, but it completely ignores the factual history.
Wasn't it because fillers are not a prescription drug in the UK? Isn't that the loophole? Like, they would need a prescriber if they wanted to use toxin, and maybe some crazy doctors giving them scripts, I don't know. But is that the main loophole? So if the government wanted to regulate and just said, you know what, this stuff is now all prescription medicine, would that help or not?
I think it would help. I think, as you say, there would always be some underground injectors. And I suspect that happens kind of everywhere. I suspect if you guys searched around hard enough in Australia, you would find some non-medical injectors who were doing things kind of under the radar.
Oh, yeah.
There's always going to be people doing that. But yeah, I think if you made it a prescription item, it would make it much more difficult to get hold of. I mean, as we mentioned earlier, I get WhatsApp messages trying to sell me dodgy knockoff toxins. So you'd be able to get hold of it, but I think it would make it more difficult. The issue with that is the MHRA, which is our kind of medicine and healthcare regulatory authority, the guys that kind of give licenses to drugs in this country, kind of our version of the FDA and the is it
TGA?
The TGA, yeah. So that's kind of our version of that. They've come out and said in the past that fillers don't treat a disease, and they are therefore not a medicine, and they are therefore nothing to do with us, and we're not interested. I think the way around it would be to make it a prescription-only device, which is kind of what things like contact lenses are. So then, they're not a medicine. They're not, they don't have a kind of physiological effect, but they do have a medical effect. So if you made them a prescription-only device, like things like contact lenses, then I think that might be the way to go, and it would make them more difficult to get hold of. You wouldn't go to a completely untrained person and get your contact lenses fitted. You go to an optometrist so they can test your eyes and tell you what contact lenses you need. So I think something like that would really help.
I'd love to get one of these people on and actually give them a fair opportunity to explain their position. I mean, I don't know if anyone's out there who knows someone that would be willing to come on and chat, but I think it'd be fascinating to get some insights from their perspective as to why, as Stephen said, they feel entitled to do these treatments.
Yeah, we've actually discussed this off air, and I thought our default position was we don't want to give them the airtime, but actually maybe it would be useful to at least hear what they have to say. I don't know. Maybe we'll put a poll out to the listeners to see if that's reasonable. I don't know. I just don't want to cause controversy, but at the same time, the reality is it's happening. So at least let's find out from the horse's mouth what's going on. Yeah. So tell us about these lipo cases, Stephen, because again, I've seen some absolutely insane stuff. There was a story going around that a woman bought basically a lipo kit off the internet and then was doing liposuction in her house with, obviously no training, but also no regard for sterility or patient care or safety, nothing.
She's turning it into soap. Like Fight
No
Club.
idea. Stephen, give us the goss. What was it all about?
Yeah, so there's been kind of 2 or 3 of these cases over the last kind of 2 or 3 years of, again, non-medically qualified people doing liposuction, using genuine kind of liposuction cannulas, which, they're kind of like foot-long surgical steel cannulas with all the holes down the side, attached to various suction devices, and then making incisions in people and sucking fat out of their neck or belly or wherever they have the fat that they don't want. And I think most sane people would consider this to be a surgical procedure. But it's, again, in the UK, it just seems that anything goes. And there are people doing this in beauty clinics, in their houses, in the kitchen. And we've seen and shared videos of these procedures being done. We've got footage of beauty therapists being trained to do this. And the authorities seem kind of relatively powerless to do anything about it, which, again, sounds completely insane. But the very first time we kind of came across this was somewhere kind of down south. And I managed to find where the clinic was and who ran it. And, I got my kind of Google stalker hat on and found out who this kind of person was. And actually, I thought, I'm going to cut out all the middlemen here and I'm going to write directly to the director of public health for that region. I thought, I'm not even kind of messing about. I'm just going to go straight to the top. And spoke to the director of public health for that region, who was as flabbergasted as probably a lot of your listeners now are that this sort of crazy stuff is going on, and was like, okay, leave this with me because I can't have this happening on my patch. This is just ridiculous. So he kind of went away and spoke to all of the people that he needed to speak to in training standards and health and safety and, all sorts of things like that. And health and safety went around to clinic, and trading standards looked at all the things that were going on. And the Director of Public Health looked at all the legislation that he could potentially look at. And basically came back to me and went, under the current legislation, there's not really an awful lot we can do it for. And it was like, excuse me, what? And it was like, no, there's environmental health have been around, and she is using surgical instruments. She is getting them sent away to have them properly sterilized in a sterilizing unit. They've looked at the kind of cleanliness of her clinic and what have you. And under the current legislations, that there's nothing that they can do about it. Trading standards were kind of like, well, there's no legislation that specifically says you can't do this, which means it's fine. So he was left with about the only avenue he still had open to him was if the police were prepared to prosecute her for performing surgery. But the police basically said, if no patients have complained and no one's been harmed by it, we're not that interested in it. So the poor Director of Public Health was kind of left there with this procedure going on his doorstep, and absolutely nothing he could do about it. And then, as I say, over the last kind of couple of years since then, we've seen more of these procedures being done, and people, posting about training courses, and they're doing some fairly horrific lipo in necks. Some of the videos are eye-watering. For those of us that kind of know head and neck anatomy, we kind of sit there looking at them rogering about in necks with liposuction cannulas in an awake patient, kind of thinking,
whoops, that's your carotid artery. No.
Oops, didn't mean to go through the windpipe. Sorry about that.
This is like patient death.
I mean, what you said is scary, because they're basically saying until someone dies or has a bowel perforation or anything else, can't do anything. They're waiting for a disaster.
What's going on in the UK? How did you guys effectively colonize all the earth, all the world?
By being insane. Yeah.
Well, it's the same thing, as I say. It's a reactive rather than a proactive kind of situation. We just carried on doing whatever we wanted until someone told us we were wrong. And at the time, what we fancied doing was sailing around the world, bopping everyone on the head and telling them that we were right and they were wrong. So we kept doing that until someone went, wait a minute, maybe you didn't want to keep doing that.
You guys should just start like an online series of like practitioners that go in with hidden cameras and have these procedures done, and just start posting them online and just see what traction you get from seeing them.
I mean, just shine a light on it.
Yeah.
Who's training these people? Because I understand that some non-medics are training non-medics. I can sort of understand that, because that's sort of how it would work. But there must have been some medical input as well. I'm sure that there are rogue practitioners who are sort of sharing their skill. Have you found that, Stephen?
Yeah, I mean, medicine and dentistry and nursing is no different to any other profession on the face of the planet, and that there will always be the odd kind of rogue character. We know that, and that's why we have regulatory bodies to kind of help police that. So there are almost certainly some rogue medics out there kind of enabling these people by teaching them, training, prescribing for them, all the things that I disagree with. We know it happens. The other issue that we sometimes have is, and this was just highlighted to me this morning, actually, in a WhatsApp message from a friend of mine, because of how out there the situation in the UK is compared to the rest of the world. And as I mentioned earlier, the rest of the world don't always appreciate how bonkers the UK is until it's pointed out to them. People will go and train abroad. It was highlighted to me today that there are non-medics in this country who are showing off certificates as having trained with someone who is very well thought of, very eminent within the aesthetics community, whose name I'm not going to mention because, they may not be aware of this. But they're based overseas within Europe. And these non-medics are kind of showing off certificates of having trained with her. And I suspect the issue is that they've applied to the training course, and whoever it is that's doing the training has just assumed that they must be in some way medically qualified, because it would seem logical that if you want to stick needles into people's faces, you must have some sort of medical qualification. Yeah. So I suspect some of them are getting trained by either, not admitting who they are or openly lying about what their background qualifications are, and they're just slipping through the net.
Yeah, that's terrifying. And then, of course, there was another story going around just this week, I think it was shared on our Patreon, that there was a non-medical aesthetic training company in the UK offering a cadaver course.
Yeah, and again, actually, when we've kind of finally done some digging and got down into the details of this, it appears that whoever was trying to set it up was either by omission or by outright lying, but had basically kind of duped a fairly prestigious university in London into running a cadaveric anatomy course, which was open to medics, but also open to kind of non-medics. And the training company that were hoping to run it are very well known for training non-medics. The person that runs it was one of the first non-medics in the UK to train, and has gone on to train probably hundreds, if not thousands, of other non-medics. So they were hoping to run this cadaveric anatomy course at a fairly prestigious university in London. And it was all kind of going ahead until various people kind of got wind of this. Again, the British College of Aesthetic Medicine got wind of it. The Human Tissues Authority were alerted that this was going on. The higher powers at the university in London were advised as to what was going on. And the collective decision by all of those, or the kind of what was kind of forced upon the university, was to pull the plug on this course, and probably kind of rightly so.
Was this King's College, was it?
Yeah, these are people that have donated their bodies for the betterment of human kind of science. Right. And, they're used at medical school for doctors and nurses and dentists to learn their anatomy, which is obviously important for us when we're performing surgery and doing kind of undertaking medicine. So these are people that have very graciously donated their bodies to medical science. And I think the feeling is that if the patient's relatives found out that these were being used by non-medics to kind of improve their anatomy knowledge, it might not go down very well.
Yeah, it certainly wouldn't have been in that donor's mind that might be a possibility, put it that way. Is it actually illegal for a non-medical person to learn that way? I don't know.
Again, in the UK, it's probably not illegal. This was something that was brought up in some of the groups that I'm in. Are they actually doing anything legally wrong? And the answer, again, in this country is probably not, because, anything goes. So they're probably not doing anything illegal. I think when it was pointed out to the university and the Human Tissue Authority and what was going on, they kind of felt that morally it probably wasn't the correct thing to do.
Yeah.
But as you say, probably not illegal.
So if there's someone listening to this in the UK, I don't know if patients listen to our podcast because we're aimed at healthcare professionals, but let's say that this sort of story gets out to the wider public. What would your advice be to, people wanting to get injections, to seek out someone reputable and, medically trained? How does a member of the public do that?
With difficulty is the honest answer. Again, because there's no licensing scheme, there's no kind of central repository of who's doing this. There are various kind of voluntary authorities. There's a company called Save Face that runs a voluntary kind of registration system that has some checks on kind of, clinic facilities and that sort of thing, and you have to apply and pay to be on that. Alice Davis actually has a number of suggested practitioners on her website, and that's usually people that she either knows or has worked with or have been recommended by people that she knows. So I'm on that, and various other kind of people are on that. But as I say, these are all kind of voluntary registers. There's the JCCP, which is the Joint Council for Cosmetic Practice. That's an arm's length government body that was set up to look into the whole aesthetics industry, and they have a register. So there are registers out there, but there isn't kind of one central register, which makes it tricky. And just because you're not on these registers doesn't mean that you're not any good, because you obviously have to pay to be on all of these registers. And as I say, because they're voluntary, there's not always an awful lot of benefit to forking out the cash to being on them. So I think my advice is always, ensure that your injector is medically qualified in whatever way you want that to be. Make sure you've looked up their GMC, NMC, whatever registration, and then look at their work and take recommendations. I think there's definitely an art and a skill to what we do, Jake. I'm sure you'll agree. And just because you're a doctor or a nurse doesn't actually make you any good at it. It means you've got the background qualifications and the nous to know what's going wrong if something goes wrong, and perhaps the knowledge to know what to do about it. but that doesn't mean you've got any artistic skill. So, you know, just because the person's a doctor or a nurse doesn't mean that they're going to give you a beautiful, fantastic result. It just means that they're hopefully going to give you a safe result. So I think as well as checking registers, you need to be looking at results, getting recommendations. Don't be afraid to ask. I think that's the thing. People in this country and probably in your country are a little bit reluctant to admit that they want to get toxin or fillers, or, you know, that they don't like something about the aging process. So I think, you know, we need to get over that and actually just ask people where they're going and who they're seeing.
Yeah, good advice. I mean, the only thing I would add is maybe, you know, book a consult once you've done all of that homework, and don't commit to a treatment. Just suss them out, talk to them, ask them 100 questions, have a look around their clinic. Does it seem legit? You know, I mean, just use your sort of spider sense. Does this kind of make sense? What do you think, David?
Yeah, I mean, I still find it difficult to believe that people wouldn't ask those questions, but maybe I've been inside the bubble for too long that it seems so obvious to me. But yeah, as you said, ask. We definitely get patients that come and see us kind of, you know, months or years into their aesthetics journey, and they're unhappy with some treatment they've had. And they're like, oh, by the time I got to the clinic and I booked in for my lips or whatever it might be. And even when I got there, I kind of got this feeling that something wasn't quite right. And you go, okay, so what did you do? And they go, I sat there and got my lips done. And you're like, why did you do that? You know, so we always keep our consultations and our treatments separately. That's just what we do. You know, I'm not saying that I'm 100% right and everyone else is wrong about these things, but, you know, I agree. We do our consultations separately. We sit down, have a long chat, answer a million questions, come up with a treatment plan, give them a copy of their treatment plan, and send them on their merry way and tell them to go away, have a read, phone their friends, you know, and speak to other people. And then if they're happy and want to book in, come back to us. What
do you charge for your initial consult? Because the only negative to that, and I agree that would be the best way of doing it, is that people kind of come all amped up, ready to do something, and then they sort of feel like, oh, I've got to wait another month or whatever it is to get into your waiting list. I mean, that shouldn't be a problem if they knew before that that's the process.
It's always made abundantly clear that treatments are not taking place on the day that we meet you for your consultation. So people do pay for consultations with us. It's not a huge amount. I think we charge £50 at the moment, which is not a huge amount, but it does remove some of the kind of tire kickers, if that's what you want to call them. You know, the people that are just scouting around for opinions or wanting to kind of get all the advice, but without actually kind of, you know, paying any money. So we do charge for our consultations, but it's made very clear that the consultation is part of the process, and that we will be sending you away with the treatment plan, and you will be booking in for your treatments at a later date. Yeah.
I wonder whether AHPRA will apply that to
maybe
injectors. I mean, that was
what's happened with surgery now.
Exactly. It's now a stipulation for plastic surgeons that the patient has to have 2 consultations. One, obviously initial one, they have a cooling off period, and then they go back again and I guess confirm everything. And depending on what you're going for, I certainly see the benefit of that. But if it's something super duper simple and logical, and you know, sometimes it can feel a little bit too much. But yeah, who knows? Maybe we'll move towards that one day. I mean, if you had the power, Stephen, if you were made an MP tomorrow, what would you do? What's the path forward? What does the UK need to do?
With regard to aesthetic medicine, or if I was made an MP, what else?
No, just keep it to aesthetic medicine.
So free Ferraris for every blonde injector from the Northeast is not a policy I can institute.
Yeah, no? Sadly not.
No, I think in the UK, so about 18 months ago, the government introduced a new Health and Social Care Act, and included in part of that was the proviso to have a licensing scheme for aesthetic medicine. And they did start having a public consultation about this, about kind of how the public felt that should be implemented and what it should include. And that started a year ago. They had part 1, and part 1 was essentially dividing all the procedures that we do into kind of tiers of how dangerous they potentially are. So they went for a traffic light system of kind of mild, moderate, and severe risk, and they put that out to public consultation and got way more responses than they thought. And then there was supposed to be kind of part 2 was supposed to be the beginning of this year, and that was supposed to look at the training and qualification requirements to perform aesthetic medicine. That was supposed to go out to public consultation in January, but they had so many responses to the first part. I think they were expecting a few hundred, and they got in the region of 16,000.
Wow.
Which was the second highest number of responses to a government consultation ever, apparently. So I think they basically went, okay, January's looking unlikely because we've got way more responses to read through than we thought. So they went, okay, let's make it April or May or some point later on. And then, as I say, in May, they announced the general election. July, we had the general election. And then we've heard nothing. So the licensing scheme seems to have just kind of died a death at the moment. We've not heard anything. So I think the first thing I would do is find out what's going on with that. And I have asked, because I spoke to my MP a couple of weeks ago, and she's going to send some questions to the Department of Health to say, what are we doing with this? So I think what I would try and do is try and get that licensing scheme enacted and try and actually make it that the training and qualification aspect of it kind of came into line with my own thinking. That, you know, you have to have some background medical qualifications of some sort. You have to have a regulatory body. That regulatory body has to accept that what you're doing is within your remit. And people say about setting up other regulatory, you know, why don't we set up a register of all these practitioners? It's like, well, all the people that should be doing it are already on a register. So why are we setting up another register?
Well, a bit of a kudos to us. We were contacted via one of our patrons by a British MP who is on their way to Australia, I think, next week. And David is going to have a meeting because I'm away, but they want to find out what's happening in other parts of the world to take that knowledge back and hopefully sort of take this further forward with the British government. So
I'll report back.
Do well.
Thanks. No pressure.
Represent IA for us.
The issue with that is I believe the MP that's coming to see you is from Scotland. And again, because the UK is weird, despite the fact that it kind of claims to all be one country, it's actually four different countries who all have their own parliaments, who can all enact their own little bits of legislation. So the rules that apply in Scotland, if enacted by the Scottish Parliament, wouldn't apply to the rest of the UK.
Right. Okay.
All
right, well, maybe we can affect Scottish aesthetics first, and then that will...
Yeah, you can fix Scottish aesthetics. I mean, I'm in Newcastle. I'm like...
You're almost there.
Sometimes I think it would be nice if they moved the border kind of, 50 miles south and we kind of went and joined some slightly more sensible neighbours, given what sometimes happens in our own parliament. But, if you fix Scottish aesthetics, we'll see if we can get the border moved kind of back to kind of Hadrian's Wall.
Yeah.
And then I'll be north of the border.
Right. To end this podcast, I did see something maybe 2 or 3 months ago. It was from the Royal Society of Medicine in the UK. And I have to be honest, I didn't fully understand the story, but it looked big. They were saying that aesthetics is now a recognised specialty within the Royal Society of Medicine. What does that mean? Does that mean that there, again, maybe some sort of chink of light to some sort of regulation or recognition or qualification?
Yeah, I'm not sure is the honest answer. The Royal Society of Medicine is a charitable body that was set up 200 odd years ago with a view to providing medical education for kind of all doctors and surgeons kind of under one roof so that they could all kind of, cross-pollinate and learn from each other and kind of learn what, each other got up to. And over the years, it's kind of continued that mission to kind of to educate people. And it now has a big prestigious building in London. And does lots of educational courses on various different kind of aspects of medicine and surgery that are open to all its members, and actually open to kind of non-members as well. And they have teachings and trainings from all the different medical specialties, so kind of cardiology, respiratory, plastic surgery, any specialty you kind of care to mention. And what they've done recently is decided to recognise that there is enough going on in the world of aesthetic medicine. There's enough treatments that are very specific to aesthetic medicine to have its own kind of specialty. And that's the first new specialty they've recognised in a long time. I can't remember the exact number, but it's certainly the first new specialty they've recognised in a long time. So they will now have a little kind of subcommittee that looks at organising teaching and training events that are specific to aesthetic medicine. So from a legislation point of view, I don't think it kind of gets us anywhere. From being able to shout about it and kind of go, look, even in the world in the broader world of medicine, it's starting to be accepted that this is a kind of separate entity. I think it gives us another kind of stick to beat people with. But I don't know that the Royal Society actually does any particular campaigning itself. But, being able to say that and being able to kind of write that on the emails that we send and the letters, the grumpy letters that we send to people, is a useful piece of information.
Yeah, I guess it's like 1 centimetre closer to sanity, because at least you've got your own profession recognizing you. You know, that if you can't even do that, then you're certainly not going to get the non-medics or the government to believe in you. So I don't know. I've got some optimism that it might help in some way.
Time will tell.
It's an incremental step, as you say. It's a bit more recognition that what we're doing is something that is different to what other people are doing.
Yeah. Well, Stephen, thank you for sharing your insights. It was, I guess, a different one this week, but no less important. It was an awful story, and hopefully we can, get the message out that these things are incredibly dangerous in the wrong hands. And to my understanding, even the right hands, in most countries now, non-surgical BBLs are supposed to be done by plastic surgeons under ultrasound guidance. That's the gold standard now. So unless you're a plastic surgeon with ultrasound, just don't go near it, please.
Yeah. Plenty of other things you can do.
100%. Well, thanks, mate. We look forward to seeing you at the next event, merry-go-round conference somewhere in the world, somewhere exotic with a Negroni.
Always.
Take care, mate.
Thanks, Stephen.
See you later. Thanks.
For our latest news, follow us on Instagram at Inside Aesthetics Podcast. If you want to get in touch with myself or David, follow us on Instagram as well at Dr. Jake Sloan and David_Inside Aesthetics.
Join our Patreon for invaluable business and injectable education. Get access to our global community of like-minded professionals, live and interactive Zoom sessions, hints and tip videos, webinars, and more. Head over to www.insideaesthetics.com/Patreon for more information.